Hello, everyone. My name is Dr. Sue Paul. I'm the Senior Director of Wellbeing and Brain Health for Asbury Communities. It is June and it's Men's Health Month. And this month, we are honored to have our guest expert join us today. It's Dr. Jyoti Rao. Dr. Rao is an internal medicine physician, a functional medicine practitioner, and a men's health expert. So, Dr. Rao, thank you so much for joining us. You want to tell us any more about yourself and how you got into this?
Sure. I'm an internist for 31 years, and so a lot of screening and just men and women's care, adult medicine. I got frustrated with the traditional route, kind of just giving pills and band-aids and things like that. So I became an acupuncturist as well. So I started to do kind of enter the concept of healing mode versus band-aid mode. And that led me to a whole new area of functional medicine, which is really driving root cause. So, for example, if you have high blood pressure, three people in the same room who have high blood pressure don't have it for the same reason, and you want to be able to try to delineate and kind of go after what is the cause of the problem instead of putting on a medicine only that can maybe give you some side effects that cause other problems. So I'm not anti-meds, but I try to do a lot with lifestyle, with diet, exercise, sleep, mental health, stress reduction, which takes care of a lot of the problems. We just live in a fast world and people don't have time for things. So I feel like being proactive, being preventive is kind of what I talk about with patients a lot and try to get them sleeping, do stress reduction, the normal stuff, whether it's a man or a woman, it's the same. But there's a subset of men, I think, that are just, they wait for the arm to drop off, kind of a thing. Like they're not bothered by, they don't want to go to a doctor. They're usually brought in by their wife or their mother or somebody else is bringing them in because it's not common for a man to want to go to a doctor. So
Mhm.
by that point, I have to put out some fires. So all the tools I've learned over the last 15 years in functional medicine really help with that kind of an issue for when it comes to men's health.
So, at what age should men, start getting routine screenings and maybe which ones are the most important?
Right. Cardiovascular health is still the biggest issue. Cardiovascular death is still the biggest issue. So to kind of go on all the risk factors for cardiovascular disease, which starts with weight, waist circumference, right? So that's easy. You can watch your weight. You can check your BMI on any calculator that's available. A BMI isn't perfect. It's a height weight ratio. And you want to be under 25 most of your life. Some people will say also your height and your waist should be 50% of your height,
Hmm.
really hard. You can tell by if your belt loops are getting, harder to buckle your pants or your belt. And that waist, that fat in the midsection, if that starts going up at 25, 30, I mean, that's when screening should start.
Okay.
I would use a blood pressure monitor at 30, just gauge your blood pressure. I think we need to be much more proactive. We're seeing a ton of chronic illness in younger and younger people. We're seeing colon cancer in younger people. We're seeing diabetes in young kids and young adults, and obesity is crazy high. It's at the average person in America is either overweight or obese. So it's kind of normal to be overweight and obese now. So that
Mhm.
leads to a bunch of medical problems, including metabolic health issues, diabetes, insulin resistance, metabolic syndrome. And, we're linking now glucose control and insulin resistance to a lot of cognitive issues like
Uh,
dementia. Dementia starts, for example, 33 decades probably before you're diagnosed. So everything's about being proactive, right? So you
mhm.
want to look at risk factors, you want to look at sleep patterns, stress
Right.
levels. Not everything is measurable per se in a classic, internal medicine profile, blood profile. I have a lot of patients who come to me feeling terrible and their labs are quote unquote fine, but it's the trends and the monitoring. So if you started getting blood levels at 30 and blood pressures at 30, you're going to see bumps, 2 points, 3 points on your glucose, fasting glucose, a couple of bumps in your blood pressure, a couple
Uh-huh.
of inches in your waist, right? You're going to see trends that are going up. That's really where you want to be proactive, right?
Right.
Because we want to catch things before it's a lot easier to put out things and just change lifestyle before you have a diagnosis. It's not impossible to get rid of that diagnosis depending on what it is, but it's always better to be proactive. So I like screening at 30, generally speaking,
Wow.
of like lipids, glucose, insulin, just because we're seeing everything much earlier now. We're seeing a ton of shingles, which used to be when
Mhm.
I started training in the 60s, people were getting shingles. Now you know that the vaccine recommendations is coming decades earlier because we're seeing it more. That's a sign of immune failure, that your
Mhm.
immune system is not able to hold that chicken pox. And it's not as much in the newer, younger people because they're getting the chicken pox vaccine, so it's hard for them to get shingles. But for the people like my age who, had
Mhm.
chicken pox, we are seeing it in earlier and earlier people. We saw a ton in COVID. So my point is that there's stressors in our system that are unique to our where we are now. There's different levels of toxins and antigen burdens. There's stress levels that are pretty high. There's sleep qualities out the window, and these things are part of the problem because it's not only just the blue light issue that's in our face that tells us not to sleep, but it's also the constant change of thought, like the inability to stay focused and present. That's
Yeah.
also kind of causing a lot of, um, you know, imbalances in our body.
Mhm. Yeah. The human condition is not made for that.
Right.
That
And we're
much
not
distraction.
moving. We're
Right.
indoors, we're
Yeah.
sitting. So there's a lot of lifestyle stuff that's adding and contributing to our problems, our health
So I
problems.
like how you frame that it's not really an age when you need to start screening. It's you need to start screening in order to track trends over time.
Yes.
And the younger the better almost because you can track those trends a little more
Yes.
accurately, but also just paying attention to BMI, waist circumference, things like that and when your belly is growing, like that's a
Right.
trend, right? And you can
Or
keep
maybe
track
a
of that yourself.
performance issue. I used to be able to run for a
Mm-hmm.
mile at a speed of X, and of course your speed's going to change, but now I can't even do half of that. Like that's a
Yeah.
problem.
Yeah.
Listen to your body telling you things that are inflammatory. So, our car lights go off, right? Our engine lights go
Mm-hmm.
off, they flash, and
Right.
hopefully you pay attention. I'm not the best with cars. Sometimes I ignore it. But that's what we do to our body, right? We duct tape the symptoms. We're like,
Mm-hmm.
oh, well, that back pain wasn't there before, but I'm just going to ignore it.
Right.
And then, I'm more tired in the afternoon, but I'm going to ignore it. I'll just have another cup of coffee. My
Right.
knees are hurting. I'll just ignore that. So your body's constantly telling you things. And
Mm-hmm.
so my issue is just, check back in. You not necessarily make an appointment with the doctor, but am I sleeping? What am I
Mm-hmm.
eating? What am I putting in my mouth? Am I eating enough fiber? Is it whole foods? Like, what is the quality of my foods? Am I drinking enough water? Do I
Right.
move enough? Do I see the sun enough?
And that's
Start
not
going
even
back to the
hard. Like
basics.
those aren't hard things. Like that's just
No, no, but we have to
basic.
think about it, right?
Yeah.
We have to pay attention. And so part of it is like when we get the third infection in 6 months, we're like, why is my immune system so bad, right?
Yeah.
Just go to the doctor, get an antibiotic, and leave is not the answer. It's like, why am I
Right.
getting sick so much? What's changing?
Right.
I never used to get sick. See, these
Right.
are little signs that tell us something's off, right?
Mm-hmm.
So that's the trend. So I don't like to put a number, even though there are hard, fast numbers and guidelines for screening. Like at 40, we want to start checking people's blood pressure. Like there are guidelines that are there, but you know what? Everybody just should know what is right. Like if you're a smoker and you're 50, you should get a calcium score CAT scan. You should get ultrasounds of your abdomen if you're in your 60s and you have hypertension because there's aneurysm risk. But your doctor and you can guide that also not just based on an age, but based on what your symptoms are. And
Mm-hmm.
obviously, if you're still smoking, I would have you stop smoking. But the
Right.
thing is that the screening tests are there. We've just changed the requirement, not just, but from 50 to 45 for colon cancer screening
Mm-hmm.
because we're seeing tons of it in 40-year-olds.
Yeah.
So maybe you should get screened at 40 if your family history is there or you're having blood in your stool. Like it really depends. So I don't like to necessarily put a number on it because then people hold fast to that
Right.
number. And
Agreed.
so my point is just listen to your body, pay attention to how things are changing. And everybody says, oh, I'm just getting older. But you don't really age from 38 to 40.
Right. Right. Right.
So if there's a significant drop in your functionality and your ability to sleep or ability to work out or ability to think in your job, that's not just aging.
Mm-hmm. So regarding men's health specifically, what do you think are like the 3 to 5 most important lifestyle factors that men should pay attention to?
I think that the biggest issue with men in general, and I apologize if I'm like making a broad statement, but men just need to care a little bit more about prevention because I feel like the problem is that it's always after the problem started, after you get the chest pain, after you get the blood pressure elevation, after you're diagnosed with
Right.
diabetes, right? So biggest one, first thing is like just do the screenings regularly, even if you feel fantastic. Go to the doctor and listen to what they say. So my executives, I take care of. The hardest part is that they're really stressed and busy, whether they're
Mm,
male or female. It's very challenging for them to say, okay, I'm going to take 20 minutes and meditate. But I think that these things, or even prioritizing sleep, for example, really important to shut that email down and shut the process of our brain's activity because if we're not sleeping, I guess that would be the one thing, sleep, quality,
sleep.
timing, because of the fact that, there is this mentality that I'll sleep when I'm dead, which
Right.
is, let me just get my work done. I got so much to do. I don't have time to sleep. And it's also worn as a badge of honor. I sleep 4 hours a night, that kind of a thing. I'm not lazy. But your sleep quality and your sleep really will dictate when that end is going to come because sleep actually makes you age faster or the lack of sleep. And when you
Hmm.
sleep, you detoxify, you help your blood pressure, you help your cortisol, you help your sugar level, you help your immune system. There's so many things that our sleep quality does, which is restorative sleep. Not that I lay in bed and stare at the ceiling for 4 hours or I get up 5 times because I have to pee. It's restorative sleep. It's continuous sleep that you go through
Hmm.
all the sleep stages. That would probably be my first priority for a man or a woman because it just isn't thought about as much. The
Hmm.
second thing is that when we sleep well, it really does tie into other good lifestyle changes. Like when I'm sleep deprived, I definitely crave sugars and fats more. So diet is very, very
Yeah.
important, right? And also your window of opportunity to eat increases when we don't sleep, right? You're up at 10 and you're like, why am I craving potato chips at
Right.
10? It's because your body says go to bed. That's why you're craving potato chips. Just go to bed, forget that pantry because we
It's a
want to
great
give our
message.
we want to give rest and we want to give periods of rest to our gut and our liver. Ideally, 12 hours for most people will be fine. And so if you eat at 10 p.m. at night, you shouldn't be eating till 10 a.m. But remember that all of our organs are linked to the sun, the circadian rhythm.
Hmm.
So if we eat the bowl of pasta at 10 o'clock at night, it's going to be taxed a lot more than if we eat that bowl of pasta at 4 p.m. or 5 p.m. or 6 p.m. because our pancreas is working with the clock. And when the sun sets, it's taxed more. So the sleep's role is also that it minimizes that window of eating opportunities. So
Right.
we're not craving. And then when you do crave something, what is it for? Am I craving it because I'm stress eating? Am I craving it because I'm bored? Am I craving it because my brain is just tired and I should just go to bed instead of eating this something? So it's really important to recognize the cues that our body's giving us. And so it's most likely not because I'm nutritionally deprived and
Right.
I need more nutrients, right, at 10 o'clock at night. So the next one would be food, but it's linked to the sleep because the food that we eat and the messages that we're signaling is directly impacting the gut, which is where 80% of our immune system sits, and 80% of the cells that make the itises in our body, like an itis of anything, shows up as high blood pressure. Itis of the brain is anxiety, depression, cognitive changes. Itis of our lungs can be shortness of breath. So everything is a function of an itis of something. And those cells are immune cells that are gotten unhappy. And so
Hmm.
that itis, the food that we feed to the bugs in the gut, the microbiome, the thing that makes 3 trillion, the bugs that make all those 3 million genes for us, they need to be signaled with good food, whole food, lots of healthy water, nutritious foods, right? Not just saturated fats and salts and sugars, which taste good in the immediate sense, but then in 2 hours, you're craving that stuff again. So when we have caloric dense foods versus nutritionally high foods, the body's going to respond differently.
Hmm.
And so that would be the second thing, but it's directly linked to, and it's hard to prioritize these because I think everything's important. But, the third thing would be the mind body connection. If I'm walking out stressed out all the time, it really does impact my choices, my focus ability, my ability to make choices in terms of food or activity. Remember, also, when you're sleep deprived, you're not going to want to do the things that maintain your health, right? So
Right.
if I have a meditation practice and I'm just too tired because I don't want to go out in the sun today and I don't want to go out and meditate because I'm too lethargic, I'm so tired. I just sit in bed and I'm a slug because I'm tired. I didn't sleep. So it's important for us to recognize what is holding us back from the things that we need to do. So the third step would be mind body connection. And then the fourth step which like I said, it's so hard to kind of quantify these things, is move. Get out in the sun
Mhm.
and move. Just get
Yeah.
up and move. Go outside, you know. I probably should have done this on my walking treadmill, but then you probably would get seasick watching me. But the point is we do a lot of sitting. I do a
Right.
lot of Zoom calls. I do, it's really hard. And in my office at work, I have a happy light because I never go outside and see the sun. So, days like today, which is super sunny for us in Maryland, I really want to get out there and walk. So, you try to prioritize these lifestyle changes around your schedule. So, for example, in the spring and summer, it's a lot easier than fall and winter.
Hmm. Yeah.
But that
Well,
would be
that's a
the
great,
top four.
those are the top four. So let's segue from just move into actual exercise and like how the role of exercise in chronic disease prevention, especially for men. Like, do you have any advice on how much or
I
what
mean, I
kind?
think
And
I think everyone can walk.
hmm.
Most everyone can walk. I shouldn't say
Yeah.
that. Mostly everyone, walking is easy. Pair of sneakers, you don't need a gym membership, you don't need anything fancy. Put on some great, some sort of shoes that are comfortable, that don't hurt your back or soles, and walk. So walking out in the sunlight anytime, as much as you can, amazing. Obviously wear sun protection, all that stuff. But the point is that movement doesn't have to be a gym. Movement doesn't have to be a workout class or anything.
Right.
There are four types of movement. Okay. So, but I don't want to get into like all the complexities because I tend to like, people tend to say, well, I can't do all that. So I'm not just going to do any of it. Right. So
Hmm.
if you have 5 minutes in a day to move, move 5 minutes. Don't not do it because you don't have an hour. So walking 7 to 10,000 steps a day, I don't care when you do it, even if it's in spurts of 10 minutes, just do it. Right.
Hmm.
So the problem we have is, oh, wow, I only have 10 minutes. I'm not going to do anything. I'm just going to
Right.
finish my emails, right? So the point is just get up and go outside. So just move. Dance with your kids, your partner, move with, it's not garden. It doesn't have to be a gym class. It just has to be movement. When you're at the soccer game with your kids, walk instead of sit, right?
Hmm.
Park farther, spend more time walking out in a parking lot to a store. There's a lot of ways. We just have to kind of be creative. And if you can get to the next level, there's four levels of exercise. So first is flexibility and stretching. So stretching is key. Balance and so, yoga. I love yoga because it really ties a lot of these things in. You can find a yoga that strength trains, does cardio, does balance, and does flexibility and stretching. For men to do yoga, it's changing. I mean, a lot more men are doing yoga, but
Hmm.
it's not an easy transition for that.
Right.
But working on flexibility, balance, which goes away at 40, by the way, and resistance training, huge for metabolic health, resistance, and cardio. So you could see how it could be overwhelming, but you could start to do something different every day for 20, 30 minutes, or 5 days a week for 20, 30 minutes, and you can get all of those things in. And the next thing you know is you're going to be wanting to do it for 40 minutes or
Hmm.
an hour because you're like, I feel great. Your
Right.
energy
Right.
goes up, your metabolism changes, people start complimenting you. Wow, you look great. What are you doing? You want to do it more. But
Hmm.
it's that initial 2 week hump to get over.
Right.
But everybody doesn't love exercise. So just walk. Just walk with, you can even walk with a backpack with a small weight. That causes resistance training. You can start lifting grocery bags up the stairs or like do something that is practical or laundry basket or do something active in your home that's going to cause you to lift weights and move. So
Hmm.
it's hard for people who never exercise, but most people want to because they know they feel better. But it is
Right.
a 2 week hump. So you start with
Right.
15 minutes, you start with 20 minutes, and you build.
Yep. Yep. And you always, yeah, the eye on the prize, right? Gosh, in 3 weeks, I'm not going to feel any of this pain. In 3 weeks, I'm going to feel so much better. And you just
Right.
put
And sometimes
eye
you'll
on the
need a
prize.
therapist. You need a physical therapist to guide you if you have a lot of issues. You don't want to hurt yourself, right? There's
Yeah.
plenty of
That's
physical
great
therapists
advice.
who will tell you how to start an exercise program or if you're healthy enough to do a health exercise program. But most people can walk, I
Hmm.
think, a little bit even, or just even sitting out in the sun is very helpful. We
Yeah,
need vitamin D, and vitamin
definitely.
D is huge. I've started to talk a lot about circadian rhythm for people and how important watching sunrise and watching sunset and different times of the sun that give us different levels of cortisol management, neurotransmitter
Right.
management, vitamin D management. These are all really important for our brain to work, our focus, our sleep patterns. And that's easy. Everybody has access to the outdoors, hopefully.
Mhm.
So you want to be able to harness some of that and just start introducing those concepts at different times during the day.
Perfect. So, what are some of those silent symptoms that men should not ignore, even though they might feel fine?
Like fatigue is a big one. I just can't do what I used to do. And if
Hmm.
it's a significant, not what you could do 20 years ago, but if it
Right.
was week to week, month to month, a significant change, you can have silent heart issues.
Yeah.
You can have things that are, any of the symptoms that are related to I pee a lot at night. That could be diabetes, that could be prostate health. My sleep is broken. That also could be testosterone. I'm sweating at night. That's lower testosterone. Men go through andropause like women go through menopause. Um, I'm not rested when I wake up, or I have headaches now. I never had headaches. That could be signs of sleep apnea, which is
Hmm.
also in epidemic proportions because we have a lot of excess weight around. And you don't even know that because you've always snored a little bit, that kind of thing. But it is important to check out snoring for sleep apnea. Again, remember the first thing I wanted people to do was sleep restoratively. And there is a lot of undiagnosed sleep apnea, which then can be a problem in many things. Cardiovascular, blood pressure goes up, so shortness of breath. I used to be able to walk for 3 blocks. Now I can't. And so that is a silent symptom of something.
Hmm.
So we want to make sure that you're not developing bronchospasm, maybe an asthma because of the allergies. Maybe your immune system's changing and now you're allergic to things that you weren't before. Maybe it's heart disease, right? So you want to be able to check in for any sort of significant body symptom change, performance change.
Yeah.
Um, the other big thing, anything related to blood pressure, if there's blood pressure screenings at fairs or in the grocery store, just get it checked because you can't feel high blood pressure until it's too late.
Right.
Um, Low testosterone in men can also cause bone density issues. So fractures when you never had a fracture before.
Now that was coming. Yeah.
Yeah,
It's
so that's 1 out of 5 people who have fractures are men, and usually the biggest cause is low testosterone.
wow.
And people aren't getting it checked, right? So, watching those trends in your buckle, seeing that abdominal, there's scales that people can get that monitor fat percentages, visceral fat percentages,
Yeah.
which they're not perfect, but they watch the trends are what's important. You see that
Okay.
visceral fat go up, you should start to get evaluated for prediabetes and insulin resistance and all of those other things. Um, what else? I think just general cognitive issues too. I can't complete my tasks at work, or it's hard for me to remember things. I mean, this goes for men and women, but these are functional issues that are impacting your day to day should be addressed, not
Hmm.
just I'm getting older.
So we can say take my husband for example. He's the one who's really he knows that preventative things are important, but he's very unlikely to schedule it, until something goes wrong.
Mhm.
So what are and I think it's helpful if they have like a plan, like, all right, I'm going to go into the doctor and I need to ask for these type of screens, or is it something that the doctor should go ahead and suggest based on, some symptoms, or just because they're at a certain age that, like what's the best way for a man to approach his provider and ask for
Well,
certain
one
screenings?
is that in traditional practices that use insurance, a physical or a preventive exam is very different than there's something wrong with me.
Right.
So the preventive exam will look at, did you get your colon cancer screening? Did you get your prostate? Did you get your lipids checked? Sometimes they'll check for things like markers of inflammation, like C-reactive protein. That's one that I would start having people check because it's important. I would have people over 40 if they're having any fatigue, cognitive issues, mood issues, muscle mass issues, performance issues, get hormone levels tested.
Yeah.
I would have people just make sure they're getting hemoglobin A1Cs and insulin levels, so that you can make sure that you're monitoring those. So a preventive exam is going to be determined by whatever that doctor, whatever guidelines, because there's plenty of guidelines out there, but it's going to be a screening. You're
Hmm.
not having symptoms. If you're having symptoms, it's a different exam. So,
Okay.
it's like I'm gaining weight. I don't know why. That could be thyroid. That could be insulin resistance. That could be low testosterone. That could be lots of things. You have chronic, whatever. In functional medicine, it could be even more. But the
Right.
point is that it is important to get general physicals because of the trends. And remember these markers of like labs, hormone levels, even in men and women, there's a huge range of normal. You don't even know what
Uh-huh.
normal is for you unless you get it
Right.
checked when you're normal, right? So
Right.
some man who's, functioning really high capacity, his testosterone may be 800, or another man who's functioning high, his testosterone may be 400. But if I check it only when you have symptoms and it's 400, it's technically normal, but it's
Right.
not normal for you.
For you.
And
That's
so
great advice.
one
Yeah.
thing would be to follow the trends because we are all aging, right?
Mhm.
So, there's a whole thing about longevity and health span, and we have the capacity to live till, 100. And the people who are going to be 30 in 2030 can live till 125 is kind of the predisposition. And how do you want to age? What do you want
Right.
those last 10 years to look like? Do you want to be, independent? Do you want to be able to put a bag in the airplane by yourself? Do you want to be able to, travel? And do you want to, be homebound? Right? So
Right.
we have to think ahead, just like financial help and planning. We got to think about what do we want the last 10 years to look like? That involves those preventive exams. Absolutely.
Yeah.
And so, yes, you should be going in for your physicals. But if you have a problem, you should address it sooner than later, right? You don't want to wait for your arm to fall off before you start
Right.
talking about, wow, this is just weak. I don't know what's going on
Yeah.
here.
Yeah.
But it doesn't mean, guys don't want to go all the time. So that's fine. So you try some things that are basic, but at least go in for general exams because we have the capacity to keep people alive for a long
Hmm.
time.
Right.
And you just really want to look, I really equate it to financial planning.
Hmm.
Everybody's worried about, oh, do I have enough money to live into my
Right.
80s and 90s? Well, do I have enough independence, my strength? I want to preserve my vision, my hearing. I want to preserve my stature, my bone density. I want to be independent. You got to think about that. How are you going to do that? It starts today,
Right.
right? Once a
Right.
year minimum.
Absolutely. Well, Dr. Rao, this has been super informative and so great to hear from you. How can our friends out there reach you if they want to come see you personally?
So I have a practice called Shakti Health and Wellness Center in Mount Airy as well as in Elkridge. And I have the website is rawwellness.com. We have a lot of free stuff that people can learn more about. I have a book called Body on Fire that reviews some of these things and a Body on Fire cookbook that people get on
Ooh,
Amazon. It was co-written with the cardiologist, so keeping in mind the book is all about how to reduce chronic illness through lifestyle. So it's really not about supplements or meds, even though that's fine to do, but it's empowering people to choose lifestyle and implement those things first and foremost, no matter what. And so that would be kind of a foundational assessment type of thing for people if they're interested in learning more. And then my office, people can call and find out more about our practice.
that's
Um,
fantastic.
yeah, so we do kind of a more deep approach for, preventive exams based on nutrient testing, stool testing. We do hormone testing, salivary hormones, urine measurements, many other things so that we can, but it's targeted to the person and what
Hmm.
their issues are. It's not just everybody gets everything kind of a thing.
Right, right. Gosh, well, thank you so much for joining us today. I know I learned a lot. I'm sure everybody listening has learned a lot.
Okay.
So thank
Thank you for
you.